Playing on the floor of his living room, Arlo looks every inch the happy, healthy 5-year-old. But Arlo doesn't eat. Hasn't eaten, in fact, for most of his life. A little understood eating disorder known as ARFID means he will only drink milk.
It sounds awful and you shouldn't have to do that as a parent, but we don't offer him food. We don't ask him if he's hungry. He will tell me if he wants milk and we go by that. Obviously I gauge time frames and we'll make him some, but he's doing well. He's been very poorly in the past, which is why he's on supplement shakes. You know, he had his appendix out and we was at crisis point.
ARFID mostly manifests as an intense aversion to certain or indeed all foods, but it's so poorly understood that Arlo's family have struggled to get him the help he needs.
We was hitting every hurdle, every door was getting closed. I speak to so many families, not just locally, all around the whole country that are in exactly the same position as me. They go to the GP don't know what ARFID is, and you think, okay, the first door I'm knocking on doesn't understand. You know, on hospital trips with Arlo, they even in the hospital they didn't know what it was, and it's kind of, the awareness needs to be spread more, the training, the support.
According to eating disorder charity Beat, ARFID is on the rise. In 2018, about 1 in 50 calls to their helpline were about ARFID. Now they say it's 1 in 7. 28% of calls relating to children under 16 are now about ARFID, although it affects adults too. Beat also say that 8 in 10 eating disorder services in England do not provide clear guidance as to whether they provide ARFID support.
It's definitely on the rise, and quite incredibly so. And a lot of people are saying that they don't know where else to turn. It's very difficult for them to get the help they need for their loved one. Unlike a lot of illnesses, there isn't a NICE guideline on ARFID. The NICE guideline on eating disorders doesn't cover ARFID, which makes it very difficult for healthcare professionals to know, what they should be doing effectively to treat the illness. And generally, there is a real postcode lottery in terms of treatment provision.
In a statement, NICE told us there are no guidelines because there was little available evidence on which to make recommendations. We will continue, they say, to monitor evidence on this topic and revisit our decision within 2 years. The Department of Health said that through our 10-year health plan, this government will overhaul the NHS and ensure those living with serious eating disorders like ARFID are given the support they need, including by recruiting an extra 8,500 adult and child mental health staff, investing in Young Futures hubs and providing access to mental health support in every school. Arlo is now as healthy as he has ever been. Others have been less fortunate, with at least 1 death attributed to the condition. And without more research, more awareness and more treatment, those living with ARFID remain on shaky foundations. Matthew Thompson, Sky News, Essex.